Medicolegal issues in pediatrics. First of all, we have to determine what is considered as a pediatric age. Okay, different countries have different notions regarding the pediatric age, and even within our country, okay, there are three different acts with which is setting three different age limits for a person to be considered under the pediatric age. Okay, the first is Indian Majority Act, which it defines who is a major, who is a minor. Okay, so in most of the cases, 18 years is considered as a up to 18 years it is considered as a minor, beyond which it is there once they have turned 18 they are considered as majors. Okay, and there are certain areas where exceptions are made up to the age of 21. For example, marital age, etc. There is uh, debate going on. Okay, so exceptions are made. In certain criteria, it is considered 21 years. Only then you can be considered as a major. Otherwise, it is 18 years. And the Children Act, in which it states that boys are considered children up till the age of 16 years of age. Girls are considered children up till the age of 18 years of age. Okay, according to Indian Academy of Pediatrics, 18 years is the upper limit in India. But when you compare it to the American Academy of Pediatrics, they consider pediatric age between 10 to 19 years. Okay, all through the adolescence years. So that's the discussion on the pediatric age. So who is a pediatrician? In layman's term, a doctor who has special training in preventing, diagnosing, and treating the diseases and injuries in children. Okay, that is a given definition of pediatrician. In your textbook, they have gone into much detailed explanation. You can just read it thoroughly once you reach it. Okay, so a child specialist or a pediatrician means a doctor who has specialized in managing child. Okay, managing a child. That is the main area. That is the bottom line here. WHO has given a much more precise definition. Okay, a person or a physician who has been regularly admitted to a medical school which is also acknowledged and recognized in the country wherever he has studied, and the person has to be successfully they have completed the studies. Okay, only after that they can consider themselves as pediatrician. Okay, and they should have proper qualification. They should be licensed for practice. Okay, and practice the medicine which is preventive, diagnostic, treatment medicine, rehabilitation as well. Okay, so the WHO has a very concise and a very long definition of what is a pediatrician. But just for the understanding, the bottom line is it's a doctor who has a special training in preventing, diagnosing, and treating diseases and injuries in children. Okay, which age group is considered children? You have to follow the dynamics of the country where you are practicing. So dealing with patients, specifically pediatric patients in various areas of your medical practice, first is your history collection and history taking and examination. So the critical, we will just discuss certain areas here, specifically when it comes to adolescent pregnancy. Okay, if a pediatrician is treating a adolescent girl, okay, who has achieved menarche, who has reached menarche, okay, certain drugs can definitely affect the developing embryo. Okay, if at all, even if it is an adolescent girl who is pregnant, okay, certain drugs, if it is prescribed, certain medications, if it is prescribed, it can definitely affect the developing embryo. So that is the reason why it is very important for a pediatrician who is treating an adolescent girl. He or she has to ask the person or the girl or the parent that when was the last menstrual date. Okay, it has to be asked um, just to rule out any case of unknown pregnancies. Okay, because there are various sensitive issues that all the adolescent people go through, not just girls. Okay, but boys as well. Sexual relationships between teenagers, drug addiction, some behavioral problems, some sexual abuses. Okay, so these could lead to unwanted or unrecognized pregnancies. The girl herself may not know she's pregnant. Okay, that's the reason why last menstrual date has to be known. If there is any delay, further test has to be done to rule out any pregnancies. Only after which medications should be prescribed. Okay. So that is one area of consideration when it comes to history taking an examination in pediatrics. Next comes to investigation. Okay, an example which took place in AIMS. It was Shailesh Munchal versus the AIMS or AIMS Hospital 2004 case. So in this case, when the prenatal diagnosis was done for thalassemia, okay, based on the patient's mother's and the father's history, okay, prenatal diagnosis of thalassemia was done, and it showed negative. But when the child was born, the child has had thalassemia, okay, and they went to sue the doctor or the institution that they showed that the report was negative, but the child is positive for thalassemia after it was born. So this report could be an error, okay, because those days we didn't had much advanced technologies to determine what exactly is the genetic condition of the child who is within the mother's uterus. Okay, prenatal diagnosis and treatment. Okay, it was underdeveloped in the year 2004. Now it is quite advanced, well advanced. Now you can be very sure about the disease conditions or the genetic conditions the child may be carrying. Okay, but those days it was difficult. So just based on that no scientific technology can be 100% perfect. Okay, it was a well reasoned submission from the court, and there was no charges of negligence put on the institution at all. Okay, because every technology cannot be 100% perfect. There are chances of error. Okay, next coming to diagnosis. In one case of Biju versus Dr. Muhammad, 1997. Okay, the case was dismissed. Okay, negligence was submitted, but it was dismissed that wrong diagnosis is not a deficiency in service. We have discussed it earlier also. If the doctor is not able to make the correct diagnosis, it doesn't mean that you can medically sue them. Okay, you can put them under the negligence court. Okay, just because there was a wrong diagnosis. So that is one case. Another is of M. Parinamam versus Dr. Jagannathan, where the patient passed away due to rabies, and it was alleged that wrong diagnosis and treatment was given. But in defense, the doctor defended that the clinical tests were conducted and the pediatrician was called, but it didn't show any report of rabies. Okay, so that's the reason why case was dismissed. There was no negligence. Okay, there was the treatment was on time. There was no delay in treatment, but still the patient passed away. So some certain things are not in the hands of the doctors. Okay, just because of a delayed diagnosis, you cannot tell that the doctor was involved in medical negligence. Use of medications, drugs, or instruments. Certain drugs, medications cannot be used in children below a particular age. Okay, because on kids, on human children, we do not have much scientific data on clinical trials. Okay, if it is safe to use in children or not, such researches are very rare. Okay, so based on that disadvantage, various drugs and medications cannot be used on kids. Okay, so when you are prescribing certain medications, you should be, as a physician, as a clinician, you should be aware of the legal limitations of using this for a specific age groups. So there was a case in the year 2007, Kumari Shivani Singh versus Dr. A. Khokle. So where the doctor had prescribed liquid Gramonig, okay, that is contraindicated for infants who are less than 3 months of age. But because of this prescription, the child developed retinopathy, and the child had retinopathy which was premature. Okay, and she lost the vision. The child lost the vision. Okay, so but the commission held many like many other causes that there is no evidence to say that just because of this particular medication, retinopathy was developed. They could not find a link between these two situations, cause and effect. So that's the reason why that case was dismissed. Okay. Another situation is the outcome. For example, certain illnesses are they can be cured. Okay, even with minimum treatment, certain illnesses can be cured. But certain illnesses, it is progressive. Okay, even if you're giving the right treatment, it still progresses. Okay, so there was a case of Padma versus Sudha Nursing Home, where the patient was treated with enteric fever and was discharged. Okay, but the patient got readmitted because there was a delay in diagnosing and treating an enteric perforation. The child had an enteric perforation. The contents of the intestine oozed out into the peritoneal region. Okay, so that is enteric perforation. So the qualified doctors, the operation was done by unqualified doctors. Okay, they lacked skills. So the patient was reoperated in a separate hospital, a different hospital. The first form of treatment and operation was done in Sudha Nursing Home, but the patient didn't recover well. Okay, so the patient had to be moved to Apollo Hospital. So based on the complications, if the doctor understands that this case is beyond their skill or competence, the doctor has to refer it to a better equipped hospital or to a better or a better institute. Okay, even knowing that we do not have the skill, we do not have the equipments, but still you choose to perform certain surgery or perform certain treatment, then you can be charged against medical negligence. Okay, in emergency situation, if the patient is unconscious or distressed, we cannot definitely collect the proper history. Okay, but at the same time, you can definitely ask the parents if they're available. Parents has to be involved. Okay, there is a case of Babu Khople versus Dr. M. Bhatambre, okay, in the year 2000, where it was alleged that there was a wrong diagnosis, no investigation, and there delay in blood transfusion, because of which the patient got into a serious condition of septicemia. Okay, so the doctor had explained that the child was referred to him because of septicemia. After 2 days, antibiotics were started. Blood culture took quite long to be to show the result. Okay, and medication was continued and it was started as well. Okay, blood transfusion takes at least 3 hours. Okay, because it is blood transfusion is given very slowly. It does not it's just not infused into it in a one go. Okay, so uh, and that was the case. So here the civil surgeon also certified that the treatment was proper. The doctor was not held liable and the case was dismissed because doctor did everything that he could do in this situation. Okay, in emergency there are certain time limitations for the lab results to come. Okay, for the blood transfusion to work. Okay, there are certain other external factors that were limiting to give to give the immediate cure. Okay, but in emergency everything that was possible to save the child was started. Okay, all the treatments were started, but the all the steps taken naturally has its own time to take place. Okay, so that cannot be a reason why you hold a doctor responsible. Then there are referrals. There was a case of M. Vijayan versus Vishwanathan. A child with burns injury was operated, but it got infected, resulted in septicemia. And according to the state commission where the complaint was filed, third-degree burns are major problems, and it has to be referred to special burn center. Okay, the doctor who had operated it, in which institution, it was not a special burn center. Okay, so not referring to a higher center is also a serious negligence. Here, the plastic surgeon, the treatment was substandard and the compensation was given to the patient and the patient family. Okay, because this is the area where the physician has to understand, do they have the skill, equipment, or resources to conduct a treatment or to establish the grounds of treatment. If they do not have these aspects, definitely do not waste any time. Immediately refer the patient to a better facility. Okay. Next is certain special situation. So one is giving injection. Most of the kids undergo this because they come under the universal immunization bracket. Okay, any drug or vaccination, there are certain complications which every child may react to the vaccinations differently. Okay, but all the doctors who are giving injections, they should have taken all the precautionary methods. Okay, specifically any anaphylaxis shock, etc., especially after giving penicillin, xylocaine, measles vaccination. We know that these vaccinations come with certain complications. So the institute or the clinic has to be prepared with any precautions. Okay. The doctor should also do certain skin sensitivity before giving penicillin, xylocaine, etc. Oxygen, adrenaline, IV fluid, steroids, these all things, antihistamines should be made available if at all the patient goes into a complicated situation. And written consent from the parents, if preferable, before administering the injectable drugs should be taken. When it comes to blood transfusion, doctor or the qualified nurse who is responsible for blood transfusion must check the name, age of the donor, recipient name, etc., along with the blood group if it is matched or not before starting the transfusion. Pediatrician will not be responsible for wrong cross-matching or HIV test of HIV, hepatitis B, because these are the responsibilities of the blood laboratories. Okay, blood banks. Blood banks have this responsibility of cross-matching, making sure that the test for HIV, hepatitis B and C has been done before you send the blood bag to the wards. Pathologist of the blood bank will be held responsible if any infected blood is transfused for the kid. So there was also a case in the year 2003, J. Gopal versus Nagarjuna Blood Bank. So the deficiency was on the blood bank's part because they issued an incorrect donor card, that is HIV negative blood sample, but the blood sample was infected, and this blood was transfused to a child as well. Okay, and the child became HIV positive because after receiving this infected blood, and the blood bank was asked to pay compensation. So this was the case of J. Gopal versus Nagarjuna Blood Bank in the year 2003. Some other legal issues. Vicarious liability. It involves that every clinical practitioner, okay, they have a liability of goodwill, okay, operating towards the goodwill of their clients. That is vicarious liability. Okay, you have to, the decisions that you make should be for the good of your client, for the good of your consumers or your patients. Okay, so and also, if the doctor has, for example, if a doctor has prescribed certain medications or injections correctly, and the nurse, who again is qualified, makes a mistake in such case, doctor is not responsible for the Nurses Act. But if the nurse is unqualified, like student nurse or something, then the doctor shall be held responsible. Okay. For example, in Sushma Sharma versus Bombay Hospital, it was seen that there was a lack of coordination between specialist and the ICU residents. Okay, the hospital was held vicariously liable. It was seen that the consultants could have given the orders of administration of the drugs is responsibility of the parent hospitals. The consultants who are treating the case, they are not responsible for any negligence. Okay, they must have given the orders, but the hospital staff, if they didn't carry out the order, then it is the responsibility of the hospital. Hospital will have to pay for the negligence. Okay, if consultants have given the order of administration, but if it is not carried out by the nurses or other staff, it is the responsibility of the hospital to bear the compensation. Then we have res ipsa loquitur. So in this, we have an example where things speak of themselves. Res ipsa loquitur means things speak for themselves. So in this situation, there was a case of Ashwin versus Manipal Hospital, where a newborn child post-operatively after operation developed burns because the hot water bags were placed on the legs of the child, which was too hot for the child to handle. Okay, and it does not require any other further proof. Okay, it was a responsibility of the hospital to make sure, the caregivers to make sure, not the patient's caregiver, the general caregivers, nursing team, doctors, to make sure that the temperature of the hot water bag is adequate, it can be tolerable by the child, for the child. So it was not looked after. So definitely the doctors were held negligent, and for the subsequent deformity that the child has to bear. So that is res ipsa loquitur in pediatric case. Things speak for themselves. Treating the child as consumers. For example, a situation in Springs Meadow Hospital versus Harjot Ahluwalia. And the Supreme Court decided that both the minor child and the parents are consumers. So if certain harm has been done to the child, okay, child is also the consumer of the services. Okay, just because it is the harm was done to the child does not mean the child cannot receive the compensation. Okay, child and the caregiver, the parents, both are the consumer team, okay, who's availing the services. So if anything wrong happened to the child under the care of any hospital, the consumer team, that being the child and the guardians, will have to get the compensation. Okay, and a compensation can be awarded to both, okay, for the child's future and child's treatment, along with the caregivers for the additional time, energy, and the loss of quality of life that they may have to endure. Okay, so both can be get both these parties will get the compensation. Then we have the limitation period. It stems from the Limitation Act, which states that an individual must be aware of his rights, and whether if these rights are infringed, one must act within the reasonable time to get back these rights. Okay, for example, if a child, if a newborn child had certain complications while being born, or after being born there was a miscare or negligence, doctor's negligence led to certain deformity in the child's future, within 2 years, okay, before the second birthday of the child, the case has to be filed. Okay, after the second birthday of the child, if the case is filed, it is outside the limitation period. Okay, the case will not be considered in the court. Okay, so for example, in case of Miss Neha Kumari versus Apollo Hospital, the case was dismissed on the ground that it is time barred. Okay, in this case, there was a medical negligence that took place, but the case was not filed on time. The parents took quite a lot of time to consider it as a medical negligence and then went to file the case. But by that time, the time has come up. Okay, so usually it is before the child's second birthday. The case has to be filed if the child is born with certain deformity which roots from medical negligence. Okay, so in such cases, within the second birthday of the child, case has to be filed. If not, then it becomes time barred. In certain situations, for civil laws, etc., 3 years is the time given. 3 years. Home visits. In some situations, when a doctor can refuse to turn down a patient, okay, at odd hours, if, specifically if it is not an emergency, home visit can also be definitely refused by the doctor. If the patient is really sick, He should attend the clinic or the hospital where 24 hours emergency services are available. If the patient is not under the care of doctor, the visit can be completely refused. Okay. If you have a telephonic call with the doctor, okay, and the patient or the relatives, that will not establish a doctor patient relationship. Okay. If the child is really sick, critically sick, it's the responsibility of the guardians to bring the child to the emergency hospital. Home visits can be refused by the doctor. Okay. Doctor is not liable for all the home visits. Whenever it is requested, it doesn't mean the doctor has to visit, compulsorily go and do a home visit. Okay. Doctors can refuse the home visits. Then ethical issues, specifically when it comes to human rights in research, etc. Experimentation on human being is again still a subject of ethical standards, and we try to respect the human health and their rights during the research processes as well. Children, if they're used as research subjects, they are more vulnerable than adults. Okay, so that is the reason why we do not have much medical researches done on children. Okay, it's a very limiting area to do medical research on children as subjects. Okay. Life support measures in pediatrics. Certain emotional feelings which teenagers go through when they are approaching adulthood. Okay, it can provoke the person for blood donation, organ transplantation, etc. Okay, for example, some costly treatment like ventilator therapy, okay, and euthanasia, etc. That these things require valid consent. So you cannot take a valid consent from a adolescent because they are minors. So thus, only ethically but legally, an individual has a right to decide whether to leave or not to leave. Okay, probably because it is only said that the individual can refuse any type of trial or treatment on his body, but that does not apply to adolescents usually. Documentation. So there was an example. There was a case of H.S. Sharma versus Indraprastha Apollo Hospital on the ground that the doctor was held liable because complications took place during the eye operation, but if it could have been avoided if proper care was given. Okay, so it was because the doctor didn't document properly the certain past history of the patient. Okay, and discharge summary should be patient friendly, and it should not be mechanical. Whenever you are submitting a discharge summary usually has the pointers that the patient has to follow when they are at home. So it should not have too much of mechanical and medical jargons. Okay, it should be in simple language that the patient understands, the patient relatives or the caretakers understand. Okay, so that's the importance of documentation. It should be properly maintained. Documentation should have all the relevant history, examinations done, investigations done, okay, prognosis, provisional diagnosis, concluded diagnosis. Consent. Consent is required in most of the medical examinations and treatment. Adolescent can refuse the treatment. They can demand privacy, okay, of medical records, but such consent must be taken before starting the procedure and after the proper explanation of the pros and cons of the process. If any adolescent is feeling too much emotions, etc., which provokes them for again any like they want to give the blood donation if because their mother is ill or father is ill. Okay, they feel that okay, they are grown up enough, they can give the blood, they can provide blood, or they can sign up for organ donation. Okay, these things should not be encouraged. Out of emotions, they can get quite emotional, they want to help, they want to do something, but you should not fall prey to such tactics. Okay, it is illegal. In cases of minors, parents or guardians have to give the consent. So child abuse, the term child abuse refers to any act or failure to act that violates the right of the child and that endangers his or her optimum health, okay, survival or development. Child abuse is a very broad concept. Okay, it does not only include physical violence but sexual, mental, and emotional mistreatment, neglect of the children, because children are dependents. Okay, so any form of neglect, deprivation of education, health, food, nutrition, lack of opportunities. Okay, these all come under child abuse. Child abuse, no, it's not just beating the child or any sexual abuses, emotional abuses. Okay, it's a very broad concept. So any victims of suspected child abuse must be examined in detail. Okay, counselor should be present to ask the right questions to the child. Earliest signs of uh, uh, any bruise marks, okay, or any hit marks. If it is seen, it has to be recorded immediately, because in children these wounds and bruises tend to disappear quickly as compared to adults. Okay, they have a higher like the wound healing is quite high in children as compared to adults. Okay, so before it gets disappeared, it has to be recorded and reported. Then effect of media should be attentive to the influence of them on the children. Usually it's most of the eating disorders, okay, anorexias, eating disorders, we know how media is linked to these eating disorders among children. Okay, so media should understand that even children are the consumers of their content, and the kind of content that they project, okay, it will have some or the other social, physical, mental impact on the kids as well. So media should be held responsible and accountable for the content that they are putting out. Okay, children should be protected from harmful, violent websites, certain computer programs and games that definitely we all know has a negative influence on them, or specifically on their psychological development as well. When to inform police in certain cases of child neglect or child abuse, the doctor has to inform the police in the following areas. In cases of suspected homicide, that is murder, in cases of suicidal deaths, unknown unconscious patients, okay, death on operation table, suspected unnatural death, unexpected sudden violent and unexplained death, instant death after treatment or reaction to medications. Okay, these are the areas where uh, immediately police should be informed. The information should come from the doctors. Any cases of poisoning, accidental deaths, okay, these all areas should be informed immediately to the police or law enforcement. Even if it is an unexpected or rare complications that can occur, okay, it should be under the police or the law enforcement's knowledge. Then we have the IMS Act. It's usually the Malnutrition Control Act. Okay, so inappropriate infant feeding practices that result in feeding difficulties and malnutrition, and it leads to infant mortality and morbidity in children. Okay, so to approach this, I guess more than IMS Act, ICDS, Integrated Child Development Scheme, has an important role to play in all ages of making sure that all age groups of children are well nourished. Okay, ICDS program, Integrated Child Development Scheme, under the WHO and UNICEF. Okay, they are catering, they are pumping a lot of money and funds to make sure malnutrition in children, okay, from all the ages, right from the infancy to adolescence, okay, all the ages, it is removed. We have various national act, international codes, national acts like Infant Milk Substitute Act, etc. Okay, they all try to make sure that no child acquires diseases just because of malnutrition. Okay, that's the propaganda that we are trying to push into the regular day-to-day lives of our citizens. So there was a case of Amit Masi versus Jay Iyer in 2013. It was recent. A low birth C-section baby was born. Okay, 3.1 kg, and the child developed jaundice on the fourth day after birth, and the baby was shifted to another hospital without mother. Powder milk was given in bottle. The baby vomited, developed aspirational pneumonia, resulting in subsequent infection, septicemia. Okay, and the child passed away ultimately. Okay, and the compensation was awarded because instead of when the mother was available, when you're shifting the child, you should also shift the mother as well. The mother is lactating, breastfeeding. Okay, instead of directly putting the child on any powdered formula, etc., which the child may react in a very bad way. Okay, knowing that fact, you should have shifted the mother as well along with the child. Okay, given a chance to the mother to breastfeed the baby, due care could have been given. Okay, the child could have been prevented from acquiring pneumonia and subsequent infection. The child could have lived. Okay, because of this misjudgment, the child passed away. The family lost a life, so compensation was awarded in this case. So this is just because of the nutrition. Okay, just because of the wrong choice of nutrition, it led to infant mortality. Then we have scoring system for the risk of Medicolegal and Negligence Act. Okay, so again, medical practice is again a cutthroat competition in modern society, and it has people are profit driven. Okay, and everyone is going for doctor shopping as well. Patients want to pay money, they want to pay higher fees and get the best doctor available in the area. Okay, and along with that, the patient's expectations are also soaring high from the doctor's end. Okay, so it is noted that medical profession is still considered as a noble profession, and it should not be brought down to the level of simple business or commerce. Okay, since most people in our country are poor. Okay, because of the consequence of increasing price tags of doctors' charges as well as the treatment charges, it is becoming an out of pocket expense for a middle class family or the poorer sections of the country. Okay, so there has been a scoring system developed to assess any risk of medical legal case in your day-to-day practice for the physicians. Okay, this will help the individual practitioner in assessing the kind of risk they may have in if the patient they're treating is going to fight a case against them. Okay, while you're giving the treatment. Okay, so the scoring system is based on different vital issues. Okay, like what they have to face on a daily basis: high risk, moderate risk, average risk, minimal risk. Okay, negligible risk. So based on different kind of treatment that you're giving, different kind of diagnosis you're making. Okay, different kind of discharge decisions that you make. Okay, you have to understand the decisions that I make right now, which in which score system will they come. Okay, so this is how the physicians can protect themselves, having the awareness of scoring system. They Having the awareness of the scoring system, they can understand where their actions can land them up. Okay, land them in, yeah, if it is going to be a negligence case. So that's all for medical legal issues in pediatrics. About the scoring system, you can check on table 17.1, page number 2000, sorry, 207.